Dr. Abraham, for breast cancer patients who don't understand the term, what is genomic testing?
So genomic testing, there are two types of genomic testing, what we call as germline testing, and then there's another one, what we call as somatic testing. So germline testing means the question is, if I carry a gene which can make me high risk for breast cancer. So one of the most common questions I get from our patients when I see them is, oh, do I carry a gene? Why did I get this breast cancer? And then the other question is, what's the risk for my kids, my daughter? So as you know, about 5 to 10% of breast cancers are due to an abnormal gene. To find that, we do what we call as the germline testing. That's the first, when we say genomic testing, that's the most commonly understood nomenclature. So do I carry this gene? It's a blood test, or we can take a mouth swab. That will give us an answer if that person carries a gene. Usually we test several genes, and I'm sure most of the people heard about BRCA1, BRCA2, PALB2, CDH1. Those are some of the genes we test. And BRCA1 and BRCA2 are the most common, 80% of hereditary, or those who are transmitted to the next generation is attributed to BRCA1 and BRCA2.
How is it administered?
So it's a blood test. Most of the time it's, we can draw. Usually the way we do is, let's just say if I'm seeing a patient who has, let's just say the patient is 45 years old and has a strong family history, or young patients under the age of 50 with a triple negative breast cancer, or any person with under the age of 50 can be considered for a genetic counseling. And then based upon the conversation with a genetic counselor, we will recommend the genetic testing. Usually it's a blood draw.